Welcome everyone to our HMC dental informational session. Just to start, we have a few house cleaning items to go over with open enrollment around the corner. As a reminder, open enrollment goes live October 20th. That's this upcoming Monday. It closes October 31st. This year will be a passive open enrollment, so you only need to log in if you want to make changes to your benefits. That is unless you have an FSA. If you have an FSA, you should have received an email from me about a week ago letting you know that action is needed. But otherwise, if you like what you have in 2025, there's no need to go in and change anything. It will roll over to 2026. If you do want to change something for your 2026 elections, it is required that you go into UKG and do so between that open enrollment window. All coverages will go into effect January 1st for any elections made, and we ask that you complete your open enrollment in UKG. Awesome. So what is changing for 2026 as it relates to our dental plan? In 2026, we see an increase to premium, which is very standard year to year. Here we see the breakout of what Tamarack Health is paying on behalf of us for our dental plan, as well as our responsibility in premiums. This is broken out for a per pay period breakout of our premiums, meaning we only have 24 pay periods that we're actually paying premiums on in a calendar year out of the 26 total pay periods in a year. So what I mean by that is you'll only ever see premiums taken out twice monthly. If we have 3 paychecks in a month, the premiums will only ever be taken out the first and second paycheck of the month. That third paycheck, you would not see premiums taken out. And just to drill into that a little bit further, we see our premiums broken out by FTE eligibility as well as coverage level. So our coverage levels are broken out in the rows where we see employee only, also known as single coverage, employee plus one, that's yourself plus one dependent, and family is the employee or yourself plus 2 dependents or more. Every coverage level has a different premium associated, as well as your FTE eligibility, breaks it out into those 2 columns that we see. This is where we see the premium taken out on that payday, and then these are for dental premiums. What are dependents? So dependents are your spouse, a child up to the age of 26, and then there is a clause for children over the age of 26 who are disabled, unmarried, and financially dependent upon you. There is supporting documentation required if you have children over the age of 26 on your plan listed as a dependent. So learning more about our overall plan, our dental plan is a PPO plan through Health Partners, or in other words, Health Partners is our insurance carrier for our dental coverage. On this plan, we have no annual deductible, which is great. We also have a $1,500 per person calendar year plan maximum. That means every dependent on the plan can incur $1,500 in covered expenses on the plan per each calendar year. So that goes into effect again 1/1/2026, and that would end December 31st, 2026. So let's look at some things covered on that plan or under that per person calendar year plan maximum. We have 100% coverage for preventative and diagnostic services, including basic 1 and 2 services. This means our dental insurance plan pays for the full cost of essential routine care with no out-of-pocket cost to us. This typically includes services like cleanings, exams, x-rays, fluoride treatments, sealants, etc. So these services fall under basic 1 and 2 categories and are designed to prevent dental issues and catch problems early. This helps us maintain long-term oral health while avoiding costly treatments down the road. So strongly encourage everybody to take advantage of these 100% covered preventative and diagnostic services on the dental plan. We have 80% coverage for our other basic services and major services. This means our dental insurance plan covers 80% of the cost for more involved dental procedures, while we still pay the remaining 20%. These services may include fillings, simple tooth extractions, crowns, root canals, dentures, and really other restorative treatments. Overall, this coverage helps make dental work more affordable when preventative care isn't enough to maintain our overall health. And now moving on to everyone's favorite topic, ortho. So orthodontic coverage helps reduce the cost of braces, clear aligners, and other orthodontic treatment. It's designed to straighten teeth and correct jaw alignment. So on our benefit, this is covered for both adults and children, which is really something to celebrate. Our coverage is at 50% and it's up to the lifetime maximum of $3,000. Overall, orthodontic benefits make it easier to invest in a healthier, more confident smile. Now, to best leverage the plan and all the resources available through Health Partners, they have a Health Partners member portal. To access it, you can always go to our internal Tamarack Health intranet portal. Under the HR tab and benefits, we have a quick links box in the upper left-hand corner. You'll want to select the teal Health Partners box. It's a link that will take you directly to the Health Partners member portal. So once on the portal, you'll need to create an account if you have not already. And once you're logged in, there's so much you can do. So you can look at your plan information, covered services, check your claims as they're being adjusted, or any explanation of benefits once they're finalized. If you need to print ID cards, you can do so prior to appointments. You can also find in-network providers in the area, and it allows you to filter by location, language, gender, availability, etc. It also, depending on the provider available, if there's information in there already, can give you some ratings and reviews to make an educated determination on which provider you would like to go see. So last, before I open up questions to everybody else, I just wanted to share some frequently asked questions or topics I receive as they relate to dental. So how often can I get a teeth cleaning? We have 2 teeth cleanings per year on our plan. Again, that renews every calendar year. You don't have to go to a specific dentist, but we always recommend using in-network dentists as they can save you money. Out-of-network providers may cost more to you, so that's just being a smart healthcare consumer. Orthodontic treatment is covered, and that is that 50% coverage up to that $3,000 plan maximum. As far as paying at your time of visit, this differs based off a provider. So the answer to that is sometimes. Your dentist may collect a copay or deductible up front, and the remaining cost is billed after insurance has processed the claim by that provider's office. So that differs based off of what dental office you go to. And how do I find an in-network dentist? So that is what we just talked about, looking at that member portal. You can log into the member portal and search any in-network providers in your area, filtering down by all those different features, even if it's just your zip code. And last but certainly not least, what happens if I exceed the annual plan maximum? You will be responsible for all of the additional costs after that annual maximum is reached per person, and that's each calendar year. It will renew at the end of the calendar year if you enroll in dental again. So it's only $1,500 per calendar year, and that continues to renew at the beginning of each calendar year. Any additional questions?